You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression. Welcome. This is Back at It with Dr. Decompression. I'm Dr. Dudum. Hey, wrapping up season 3, we had Dr. Brian Gatterman, associate professor. He was in studio, right? And we discussed the article of reduction of a lumbar disc herniation with spinal decompression, our published study. We're working on more studies, but he was in here in studio. It was an awesome episode. We really dove into some specifics about decompression and wrapped up season 3. On to season 4. You know, reflecting back on the questions I get, I just want to discuss the basics of spinal decompression. So we're going to call this episode Decompression 101. That's what we're going to call it. So dive into a few things today. When you leave this episode, you will just kind of understand what decompression is, who it could help, how it works, and more about it. So the spine is generally compressed. That's a universal thought, because if I throw this up, sorry for the listeners, but if I'm just throwing this up, it comes down. There's gravity compressing on our spine. Sitting, now I'm sitting. I'm going to sit for about 15 to 18 minutes, and then I'm going to walk around. I don't sit for more than 20 minutes. Sitting causes the most compression on our discs and pressure than any other position. So a lot of us are having more lower back pain, which is more common than any other condition right now. Or I'm sorry, it's more common than ever because we're sitting so much. So it's compressing our spine. And so looking at the architecture of the spine, we've got the bone here, the vertebra, the disc, which is the cushion, and the other bone. So it's a sandwich. That's called the joint. And then in between that, the disc, there's a nerve that comes out of that hole. Through compression, there's more forces on the disc. And then the supporting soft tissue, you would think of like muscles and ligaments, they fatigue over time and they don't support the movement of the joint and the forces evenly as we adapt to gravity and bend forward and bend back and lean side to side. And over time, that leads to vulnerability of the joint. And that leads to disc injuries. If we overload it and it's vulnerable, that's how you get a disc injury. That's when you hear, oh, yeah, I just went to pick up a paper clip and then boom, my back went out. It wasn't that movement. It was the movements 5 and 10 years before that that led up to the vulnerability and the inability to adapt to the disc injury. So that's why we're seeing a lot of these disc injuries. Now, where does spinal decompression come into play? We have a disc injury, so we've got disc bulge, disc herniation, and disc extrusion. And from last episode, you could tell that Dr. Gatterman is big on nomenclature and big on being specific about these conditions. So in the next episode or two, I will break down bulge, herniation, extrusion. And we'll also talk about some research as far as what does it show if these disc injuries specifically can reduce in size from decompression. So we'll talk about that next episode. Don't forget to subscribe if you want to continue listening to these episodes and future episodes. So you've got some compression, it's squeezing, and the disc has injured now, and it's in and around the nerve. That's why you get sciatica, because this disc here, it's pushing in and around the nerve, and it's causing leg pain, because this disc goes where? Not to your arm. We're talking about your nerve down your leg. This is considered the sciatica nerve down your leg to your calf and your foot. So how does decompression work? A lot of people think it's out there that, hey, you go on the table and it just pulls you apart. That is not decompression. If I get on the table and you lay and you just kind of get pulled and stretch, I could just be pulling your legs manually, or the table could be pulling you manually, or I could crank you manually. That's traction. So check this out. Traction is when you pull and you hold it. Now, when you pull long enough, hard enough, the supporting soft tissue, the muscles. So you've got ligaments in here that signal muscles what to do, and joints that signal that. If you pull for too much, too hard, for too long, those muscles are going to contract and you can get a spasm. So when you pull with traction, it could be beneficial, it could be, but you could also get a flare up and also not be able to pull enough to get the disc to come back in. Yes, it is possible with traction to get relief. Yes, not saying that. What I am saying is the difference between traction and spinal decompression is the ability to pull and go back and pull and go back. That relaxes the tension on what's called the PLL, the posterior longitudinal ligament that runs on the back of the spine, okay? And that decreases the potential for spasms and flare-ups. 90 to 95% of the patients that are on our decompression tables don't really feel anything. They take a nap or they're doing work on their phone. They're not doing anything. And they don't feel, they're not bearing down like, oh, it hurts. It doesn't. That's not how this thing works. It's gentle. It pulls and then oscillates back and forth. Now this oscillation is very important. This oscillation is what changes the pressure inside the disc. It's called the intradiscal pressure. If you think I have no idea what I'm talking about, this guy is crazy. Check out my research paper, okay? Check it out. Here's the link. We showed 4 cases where we did pre and post MRIs. The MRI is the gold standard to evaluate a disc injury. So we did a pre and a post MRI, and we measured the disc size change with the herniated disc index, and we saw disc changes from 78% to 9%. And all 4 of those patients got 100% better and avoided injections and surgeries. So I have some experience, know what I'm talking about. When we pull, it's this. This is the key. It's not this, and we don't hold, and we decrease flare-ups. We oscillate. It oscillates. Now, here's a really cool thing that you probably have no idea about, and you will not read this on the internet. You won't read this on Google. You won't read this on Reddit. You won't read it on spine.com, anywhere. Watch this, and I'll describe it for the listeners. I'm going to pull you an inch apart, okay? It doesn't really pull an inch, but an inch. Now, I can change that oscillation cycle from an inch apart to half an inch to an inch, okay? That 50% reduction. That is one possibility with spinal decompression. I can change the oscillation cycle. So I can make it more firm. I can go an inch, 3/4 of an inch, an inch, 3/4 of an inch, or I could go an inch and reduce by a 16th, like that. I can change the amplitude of the range. That is huge. So when patients are responding to one type of oscillation cycle, I can adapt to a different oscillation cycle. This is not a shotgun approach. A shotgun approach means you get a shotgun and you blast it. It's just you're trying to hit everything. This is a sniper approach. We are trying to find the exact location and the exact angle of how to fix this problem. The amplitude is one way. The angle is the other. I can angle you flat all the way to 20 degrees, laying on your back. So here at 5 degrees, 7.5, 10, 12.5, 50, I can angle you any way. Well, how do I know what, I know you're listening and you're thinking this. How does he know what angle to use? How would I know what angle to use? My experience has taught me and educated me on the best angle based on the disc injury. So this is not a, hey, I've got a disc herniation at L405. Let me target that L405. It's not like that. It may be like that, but if we have to adapt, maybe it's a posterolateral disc herniation in which I would flip you on your stomach. or maybe it's a L405 disc extrusion, and the extrusion, it really matters if the extrusion's gone up cranial or down caudal. That matters because I'm using the angle as leverage. I'm not just using the angle as a textbook or as a manual. Oh, you have an L405 disc injury? I'm going to target this area. It does not work that way. It requires clinical thought on how we're going to get that disc to reduce in size. And again, if you're not sure that I know what I'm talking about, reference the article below where we show pre and post MRIs. So that is decompression. Decompression is pull, oscillate, do that at a very specific angle over the course of time and get this disc to reabsorb a little bit, just enough to take the pressure off of this nerve, decreases a lot of the inflammatory response. It creates a healing response. And that's how we get patients to get relief from sciatica and degenerative disc disease and spinal stenosis, herniated, bulging, extruded discs. That's how this works. It is an extremely gentle approach. Now, you can do this more aggressively. I prefer not to work aggressively. I prefer to work more conservatively and range up. If you were to go too aggressive, meaning too much pull at an angle that's not the best, yeah, that could cause a flare-up. That could. So what's important to know is not angles are created equally, not patients are created equally. The size of the patient matters, the chronicity, how long it's been there, and the location and size of the disc injury matters. So I'd rather start slower and build you up than start aggressive and have to go back and then go forward. That's where you lose momentum. That, in essence, is non-surgical spinal decompression, how it differs from traction. It's how we can oscillate it and why the oscillation matters and when we should change oscillation. And number three, the angle and why it's important and how it's not a one size fits all. It's based on the location, the type of disc injury, and the patient symptoms. Those dictate the angle. And that's generally spinal decompression.
It's obvious that you're having lower back pain and you want to get relief. Text me the word relief to 925-291-5670 to download your free low back pain guide. Start fixing your back today and get the relief that you deserve.
So don't forget to subscribe to the channel, okay? If you want more information about spinal decompression, sciatica, disc herniations, extrusions, posture, corrective exercise, anything relating your back pain, getting relief, and solutions, okay? Subscribe to the channel. If you like or have a comment or a question about it, respond to this, and I'd love to talk about it on the next episode. I'm Dr. JD Dudum. This is Back at It with Dr. Decompression. Thanks for listening.